Okay, hello everybody. My name is Elias Ashooh. I am the project director for Health Market Connect. And Health Market Connect received uh, the federal grant for the Navigator program in New Hampshire. So the Navigator program created with the Affordable Care Act. The Navigators are community partners that help with eligibility and enrollment in the individual marketplace, but also other health insurance affordability programs like Medicaid. So the funding for the program has ebbed and flowed since 2013 with different administrations. With the Biden administration increasing the funding to the biggest it's ever been, Health Market Connect saw a great opportunity to bring back an in-state presence of navigators. In 2019 and 2020, it was the funding was so reduced, it was just a group out of West Virginia that was essentially holding a call center for New Hampshire residents for questions about health insurance. So with the expanded funding and over a 3-year period, we just saw a great opportunity to bring back an in-state presence of navigators. And so the kind of the approach to the program, it's definitely unique and historically where navigators have been tied to institutions like health centers or hospitals. Our approach, Health Market Connect, is 100% fully funded through the federal grant. So we exist entirely to implement this Navigator program. I refer to them as community navigators because really the focus was on hiring navigators from in communities across New Hampshire. And the whole outlook with the program is to increase accessibility to health insurance. And so the flexibility we have now where we're not tied to any institution, we can really be very community facing and partner with pretty much everybody. The parameters of the grant is a focus on the underserved and vulnerable populations that have been historically either lower health outcomes or just harder access to public health insurance. So a big focus for us is in getting this program running, because we awarded the grant on August 27th, open enrollment's November 1st, so really a short runway to be fully operational. But one of our main focuses and the whole idea of increasing accessibility, a big aspect of that was language capacity. So our navigator staff now, we have 10 navigators, all located throughout the state. Our main office is in Concord, but our language capacity, we have 4 Spanish-speaking navigators, a French and Nepali and Hindi navigators that to help us access some more of those immigrant communities of color. So I'm super excited to have a pretty remarkably diverse staff to help access all sorts of populations across New Hampshire. So we have access to the CMS language interpretation bank, but I think the whole design of this program is very grassroots and meeting people on the ground where they are. Our part of the Navigator program is outreach and education around the health insurance marketplace. Traditionally, a lot of the forms of outreach have been traditional media like television ads, radio ads. We're kind of taking a totally different approach to really try to meet some of those underserved populations where they are. So really what I hope for today is to just spread the word as that we're a resource. We're required to be unbiased, no cost, fully federally funded through the government. So really we exist to help people access health insurance. So I think I hit on all the big points. I'm super excited for this program and to bring back an in-state presence of navigators and really to be able to help people access the individual marketplace and Medicaid. I know a big focus for us is with the Medicaid redeterminations coming up. We're working with the New Hampshire Insurance Department and DHHS to try to help a lot of those folks before they fall through the gaps. So I think that's we have a main phone line that you can call and you'll have direct language assistance, whether it's English, Spanish, French, Nepali, right with someone who lives in New Hampshire, knows New Hampshire. The whole kind of program was designed for New Hampshire and to be a statewide resource, but really to accommodate the different regions across the state and to be able to provide on the ground community support tailored to those communities, recognizing that, as a small state, New Hampshire's a small state, but it's very regionalized, and Keene, Berlin, and the Seacoast, all very different communities. So providing a statewide resource, focusing on a very intentional community approach, and to try to help people access health insurance. I see a question in the chat. So yeah, our office is in Concord. We can definitely have walk-ins. I think the main phone line is, if the idea is if someone calls, we'll be able to provide them assistance either in person wherever they are in the state, or also the capacities with virtual as well. Yeah. So all right. Yes, I'm happy to share my email, or the phone numbers, and our flyer, because we're definitely hitting the ground running and trying to get the word out as much as we can for open enrollment right around the corner. And so the other piece of this is how we exist as fully federally funded, and really no other room for profit legally and just organizationally, and just how the budget's designed, where it's a priority on staff and having staff geographically dispersed, and with language capacities. We really rely on community partners to help spread the word and receive referrals to us to access some of these folks. So that's definitely another aspect of it. Is I personally think health insurance, everybody needs it and everybody benefits from it, even if you get it from your employer. I think it's a really easy thing to get behind, for so many reasons. The more people that are covered, the lower healthcare costs are going to go down, and just healthier communities will be created. So I think it's an awesome opportunity, and I'm super excited to share some information about it. So communication access include ASL interpretation. Yeah, so those accommodations are something we're working on, but we will absolutely have that capacity for the ASL interpretation. And I will some more details on that. Yep. So home visits is also something that we're hoping to achieve as well. So and that's part of the whole design of the program is, we're not tied to an institution. We can be very flexible, have a remote workforce, and really able to adapt and change as the needs of the state and obviously of public health change.
Excuse me, Elias. Thank you. We do have I think we have a few people with their hands raised.
Yeah.
I can't see everybody, but I see you, Rick.
Hi, Elias. This is Rick Menard. I'm the Executive Director at Building Community in New Hampshire. We work with refugees around the state. And BCNH, before I started here, had the Navigator contract several years ago, working primarily with the Bhutanese community and others. People who are involved in that are still around and could give you, I'd be happy to set you up so you can learn from their experience. And they may be helpful. We may be helpful today with our Nepali speaking case manager and helping you to reach out. But a question, you mentioned a bunch of languages, but not Swahili or Kinyarwanda or languages spoken by the Congolese community in the state. Do you have plans to reach them? And in any case, can we be helpful to you there?
So for our French speaking navigator, he's from Benin in Western Africa. So he has a lot of conversational abilities in Yoruba, Swahili. it's still very conversational. So I think he can he's picked up a lot on it just from being around those the people from those communities in Manchester. So we're not comfortable advertising that we have those capabilities, but we are able to accommodate more on a case by case situation where it's not fluent in those, but definitely able to accommodate and assist. But I will say, Rick, that where because we're so community facing, I'm looking for all the help and advice and tips we can get, because I think it's the more collaboration, really the better it is for the entire state.
I just put my email in the chat. You can, we can set up a private time to talk more about how we might be able to help you.
Yeah, that'd be great, because I know the Nepali woman we have on staff, she's this is her first job in the country, and she's very tied in with the Bhutanese community. But I think just helping to facilitate some of those connections is even better.
Elias, I thank you so much. I think I'm just scanning the chat. So there were, I'm not sure if you were able to answer this question. Maybe you did, I apologize, but Laura had asked if you're able to do home visiting.
Yes. Yep. So yeah, we are able to do home visits. Home visits over the phone. I know we're having conversations with the service links across the state to be able to collaborate with them, share referrals, especially for the SHIP counselors and Medicare. And we're also hoping that we will be able to use some of their space to meet with clients as well.
Okay. And Joan had a specific question about captioning for hard of hearing. Will you have that service available, or can you make that service available if you don't have it?
Yeah, so I will say we can make it available, and we want to, and have the funds too. I think that's definitely a piece that would be helpful for us in getting some of those accommodations for the hard of hearing, and for those types of consumers. Definitely something I'm interested in. Personally, don't have a lot of experience with, so any resources that we can help connect and acquire some of this technology is definitely something we're interested in.
Okay, and then Laura had followed up, and I think you may have mentioned this, but will your navigators all have access to over the phone or VRI service for language interpretation? Yes,
so for the languages outside of the navigators that I'd spoken of, we have access to the CMS interpretation bank. Personally, and we're still working on. I'd love to get some more Arabic. It's a little tricky with all the different dialects, but I think the idea was, to prioritize navigators in the communities that speak these languages, to give a little more cultural context that can't be achieved through the interpretation lines, but we still have access to it and can absolutely provide it as needed.
Great, thank you. I do believe you answered everything in the chat. If you wouldn't mind, Elias, putting your contact information and the phone number or the contact information for the service in the chat, and if you have a flyer or anything written up, we can send it out to the task force after the meeting. And the task force is much larger, of course, than the people who are here today. So we can get that out for you if you'd like.
Yeah, no, that'd be great. I can email that flyer right over. It has our local number, our toll-free number, and also the email as well too, for all that information. So absolutely.
Wonderful, thank you. And Bruce is telling me there are still hands up. Can anybody? Yeah. I can't see them, so if anyone has their hand up.
I don't know what the order was, but I know Maria's hand is up, Tiffany's hand is up. I can't see others. And Elias, you can actually put your documents straight into the chat. We're set up so you can upload from your computer, and that way.
Oh, great! I'll do that right now.
And then we can also send it out afterwards with the recording.
Tiffany, do you want to?
Yeah, so I was curious if your partnership with DHHS includes access to their systems, because I know sometimes that can be the tricky part about the Medicaid applications.
The conversations with DHHS are very ongoing. It's something I know a lot of our navigators, we've brought people on from several community health centers, and several of them are able to do and have experience with NHEZ and those Medicaid applications. It's something I'd like organization wide for everyone to be able to do Medicaid applications. So we're having those conversations now to see like what that looks like in a more formal collaboration, but it's definitely something I'm hoping to expedite, because open enrollment right around the corner. So it's ongoing. Definitely something I would like to achieve quickly.
Awesome, thanks so much.
And Maria?
Hi, Elias. My name is Maria Doyle. I'm with New Hampshire Children's Trust, and we're connected to the Family Resource Centers in New Hampshire, and also have some funding that we're starting with general benefits navigation to help with some of the benefit cliffs that are happening and about to happen. So would love to connect with you. That may also be another resource for space for people.
Yeah, yes. That's awesome, Maria. And I will say that so our office in Concord is actually located in the new Concord, I think they're calling it Capital Recovery, but the new Concord Family Resource Center. So we're really close tied in with the, under the Greater Tilton.
Yeah, excellent.
But definitely looking to expand, all across the state too. So yeah, absolutely.
Yeah, I'll put my email in the chat, and I also will take note of yours. We'll be in touch soon.
Yes, please do. Yeah, that'd be great.
Okay, did I miss anybody with hands up? All right. Elias, thank you so much. And I see you've put your flyer in the chat, which is great. We will also grab it from there and send it out because, as I said,
Awesome.
There's a lot of people who weren't with us today. So we'll get that information out for you. And thank you. Any last second questions for Elias?
This is Trini. Hi. I think it's wonderful that Rick mentioned that BCNH had Federal Navigator funding previously. I think they had 2 rounds of Federal Navigator funding, and then we had a number of organizations that had state Navigator funding. It wasn't called Navigator because that was at the federal level. But there have been a number of community organizations that have done this work, during the previous administration when there was a lot of effort to do outreach and enrollment. So I hope those that are on and we can help get the word to others can connect with you, because some of them created their systems for how to facilitate enrolling in the community setting. So I think it'll be wonderful to build off the prior knowledge.
Yeah, that's absolutely. And yeah, part of the reason I'm so grateful to be on this is to share as a resource, and also hopefully to tap into some of the expertise and experience from all the folks that have done this work in the past. So yeah, I absolutely, if anyone helps facilitate those connections, please do, because I'm absolutely willing and wanting to make some of those and to learn and collaborate.
And Trini, I sent him already our navigators. This is Eva. So
Oh, excellent. Okay.
yeah.
Yes.
I talked to him a long time ago.
Mm-hmm.
Ava was very helpful in our initial recruitment efforts for navigators. So it was awesome getting all the languages and everything. So thank you, Ava. You're a huge help.
I want to just add to the 2, Mary Georges. I'm sorry. I just thank you because with the Victory Women of Vision, we work more with the immigrants and the refugees for the in the Manchester area. And what you say about the Congolese for the language, I'm really excited for that, because this is the first time I hear somebody talk about those languages, but they never talk about what you say. They talk like somebody who speak those Lingala, Chiluba, or Swahili, all those things. This is really a good input for us. Thank you very much for that. I would like to work with you too. Thank you.
Awesome. No, it's fantastic to hear. Yeah, thank you.
Okay. Thank you, everyone, and thank you, Elias, for joining us today. And we hope that you'll choose to stay with us. We meet every 2 weeks, and you're welcome to join us or have any of your navigators join us. And it's a great place to connect with people.
Oh, awesome. Yeah, that's a great idea.
And we
Well,
can
yeah.
stop the recording now if we're done with this segment. Although if there's more conversation, please proceed.
I think we might be done.